Now, you have begun the head and neck portion. It's a small area, but everything is important. For long questions or short questions, and you have to know the skull and the bony elements of the head and neck. And yesterday, actually, in a hurry, I made a mistake. Charak, that's spelling, I just said C-H-R-A-K. Now, parotid and the submandibular gland, the boundaries of parotid bed, anteriorly posterior border of the ramus of the mandible, posteriorly mastoid process, superiorly external acoustic meatus, meatus and posterior part of the temporomandibular joint. In short form, EMJ. Now you please concentrate on these skeletal elements first, and others, everything will fall in place. And medially styloid process is the styloid process. We have two skulls. Two styloid processes, one skull, and one skull there is a single styloid process. That is, it's broken. It was broken in processing of the skeletal muscles lining the parotid bed. Ramus of the mandible, masseter and medial pterygoid. Okay, mastoid process, posterior belly of digastric, styloid process, styloglossus, stylopharyngeus, and stylohyoid. This will all also come in when you are studying pharynx. Tongue, I told you, yes. And extent of the parotid gland, above just beneath the external auditory meatus, below upper part of the carotid triangle, medially styloid process above and neck of the mandible below. Posteriorly overlaps, anteriorly extends over the masseter. Anterior part of the gland may be detached from the rest of the gland. When you see in the dissection, the dissected body, you will see you can lift up the anterior portion of the parotid gland. The accessory parotid gland, anterior part of the gland may be detached from the rest of the gland, lies between zygomatic arch and the parotid duct below. Coverings of the parotid. Now, inner true capsule and outer false capsule. Now, this is the zygomatic arch, this is the tympanic plate, the styloid process, and you see the green submandibular, stylo-mandibular ligament, deep lamina of parotid fascia, and zygomatic arch, superficial lamina of parotid fascia, investing layer of deep cervical fascia. Now, in head neck region, you will see cervical fascia. As you come along, how it encloses the gland and other structures. And true capsule condensation of fibrous stroma of the gland. Inner true capsule and outer false capsule. True capsule condensation of the fibrous stroma of the gland. The condensation of the stroma, fibrous stroma of the gland, that's the true capsule. False capsule, splitting of investing layer of deep cervical fascia, and inflammatory swelling is very painful. In bumps, it is very painful because it cannot stretch. So, you in my practice, I actually ask the patient to buy up any poppins, but poppins they are not, it is being, lot of hype is being done. Anyway, anything khatta, it can be imli sweets, it can be your anything khatta. You take it, ask the patient to take it mouth, and then you see lots of salivation and it excretes. So the inflammation to some extent, the more it is taut, it is swollen up, and that can be to some extent gives relief to the patient. False capsule of the parotid gland, superficial and deep lamella. Superficial lamella blends with the epimysium of the masseter parotidomasseteric fascia. Parotidomasseteric fascia. The muscle, that is the fascia covering the parotid, also the masseteric fascia. Epimysium of the masseter muscle, epimysium. And parotidomasseteric fascia. Epimysium of the masseter blends with the epimysium of the masseter. Superficial lamella blends with the epimysium of the masseter. Parotidomasseteric fascia. I am concentrating on this because you might be asked, those who are going for gold medal or higher marks, because parotid gland will be given in the tray of the gross anatomy practicals. So, now, the false capsule of parotid gland, superficial and deep lamella. Superficial lamella blends with the epimysium of the masseter, parotidomasseteric fascia, and the parotidomasseteric fascia is attached above the zygomatic arch. Deep lamella thickened to form the stylo-mandibular ligament. Stylo-mandibular ligament extends from the tip of the styloid process to the angle of the mandible. Yeah, the angle of the mandible. So it is covered like this. And your stylo-mandibular ligament extends from the tip of the styloid process to the angle of the presenting parts of the parotid gland. It is pyramidal in shape. It has an apex base. Okay. Superficial and lateral surfaces, anteromedial surface, posteromedial surface, anterior, posterior and medial borders. You can see the medial border, the posteromedial surface, posterior border, anterior border and anteromedial surface and the superficial surface. You please, when parotid will be shown to you, you look at this specimen. It's a good specimen is there, and you correlate in your book an atlas or your tab and see the orientation. Now, apex of the parotid gland extends into the carotid triangle in the neck, structures passing through the apex. This is each and every point is important, because when you hold it will be you draw a diagram and you describe the structures. This picture is very important. Okay. Now, structures passing through the apex, cervical branch of facial nerve, and your anterior division of rectomandibular vein, your superficial temporal vein, superficial temporal artery, auriculotemporal nerve, external acoustic meters, and the nerve, vein, artery. The cervical branch of the facial nerve, anterior division of the rectomandibular vein, and posterior division of the retromandibular vein. Yeah. This is the parotid duct, the cervical branch, the superficial temporal, this picture. Now, base of the parotid gland, concave in lining, related to external aquatic medulla, concave, this is concave base, the acoustic meters, and posterior part of the temporomandibular joint. Structures passing through the base, temporal branch of the facial nerve, auriculotemporal nerve, and superficial temporal vessels. Superficial surface of the parotid gland, skin, superficial fascia, superficial group of parotid lymph nodes, and superficial lamella of false capsule. Anteromedial surface of the parotid gland is related to the posterior border of the ramus of the mandible, related to the masseter and medial pterygoid muscles. Structures related, branches of the facial nerve and maxillary artery. This is the facial nerve, the mastoid process, external acoustic meatus, the parotid duct, this is the masseter muscle, and your digastric muscle. This is the parotid gland, facial nerve, and sternocleidomastoid muscle. And structure is the branches of the facial nerve and maxillary. Posteromedial surface, parotid gland, related to mastoid and styloid process of the temporal bone, related to belly of the digastric, related to muscles of the styloid apparatus. Facial nerve enters parotid gland by piercing the surface. Now, this posterior border of parotid gland separate the superficial and posteromedial surface. Structures related, posterior auricular branch of facial nerve and posterior auricular vessels. Anterior border of the parotid gland separates superficial and anteromedial surfaces. Structures related to the zygomatic, upper and lower buccal and marginal mandibular branches of the facial nerve. Transverse facial vessels, parotid duct, accessory parotid gland and duct if present. Accessory gland is not always present in every case. So, accessory parotid gland duct is present. The zygomatic upper and lower buccal, marginal mandibular branches of the facial nerve, transverse facial vessels, parotid duct and accessory parotid gland and duct if present. Structures passing through the parotid gland. This is a short note 4 marks. The structures passing through the parotid gland, facial nerve and its branches, retromandibular vein, external parotid artery. Facial nerve emerges from the stylo-mastoid foramen, pierces the posterior medial surface, the facial nerve trunk, the branches. Runs forward and moves, superficial structure, pierces the posterior medial surface, runs forward as the most superficial structure. Divides into temporofacial and cervicofacial trunk. The cervicofacial trunk and the temporomandibular, temporofacial trunk. This is the zygomatic branch, this is the buccal branch. Now, this is divided by the isthmus. Your facial nerve emerges from the stylo-mastoid foramen, pierces the posteromedial surface, runs forward as the most superficial structure, divides into temporofacial and cervicofacial trunk. 5 terminal branches emerges from the anterior border, branches pattern known as ancillarians. See, you hold your hand like this. Then the facial nerve branches you can see the Now, surgical importance of facial nerve branching. This is very important. Branches of facial nerve divide the parotid gland into superficial and deep lobes. Okay, the branches are sandwiched between the two lobes. These branches of the facial nerve, it goes across. This orientation helps the surgeon to remove a parotid tumor, leaving the nerves intact. This is very important. Any like swelling, like an abscess or gland or whatever it is, don't think it's an abscess or a superficial structure. Then if you make an incision, there won't be any pus or anything. And there are, and even manhandling of the parotid gland swelling. Manhandling means you are an assistant to an ENT surgeon, professor. So you have to know the anatomy. Even if you don't know, you confess. You are a learner. You ask this, your professor, just please show me how to approach. That doesn't mean that you will become an ENT surgeon. But at least you can assess, you can hold structures. Even the boss might be making a mistake. So you can say, sir, see, this is, even I have a surgery book, emergency surgery, I cannot remember the name of the author. In the initial part, introduction, the OT sister plays a key role. I'm taking nursing classes. I just tell them that you are the main person. The OT sister, and sometimes there's a bleeding in one part, busy, or you are busy with the operation, side, that's bleeding. This perhaps I'll tell you abdominal hysterectomy. If anyone, even a junior assistant, an intern, shows that sir is bleeding, you try to catch it with your fingers and then put a clamp. Say, imagine you have read the uterine artery. It profusely bleeds if the clamp is this thing or the ligature is not put properly. So, the branches are sandwiched between the two lobes. This orientation helps the surgeon to remove a parotid tumor, leaving the nerves intact. Previously, this parotid surgery related to parotid was the surgeon, your general surgeon used to do it. But now it is a super specialty, naturally ENT surgeon venture. Because general surgery, as it is now getting branched with subdivision, division, breast surgeon. It's like this. Now, thyroid and your parotid and the thing, swellings or tumors related to the your head and neck is the domain of the ENT surgeon. Now, retromandibular vein occupies the intermediate zone formed by union of superficial temporal and maxillary veins. See, superficial temporal vein, retromandibular vein, the transverse facial vein, the posterior division, this is the anterior division, the facial vein, posterior auricular vein, external jugular vein, this is, and common facial vein. Now, external carotid artery occupies the deep zone, divides into terminal branches. Maxillary artery lies deep to the anterior medial surface. Superficial temporal artery emerges from the base, and the transverse facial artery emerges from the anterior border. Now you can feel your superficial temporal, you can feel it pulsating here. It is there, and transverse facial, your maxillary artery, transverse facial, maxillary artery, and the external carotid artery. External carotid artery, you can feel the pulse here. You can feel the pulse here. See, when you are not getting any pulsation in the radial pulse, your brachial pulse, you just feel here, because it is closer to the heart. It's pumping, so you can feel. Because see, when an emergency, your patient comes half dead, you are not getting the pulse. Of course, nowadays you put a monitor or anything, but monitors and all things to be put in, and this, by the time you just feel if there is any pulse or not, and the pupils are dilated or not. That means he is dying. But sometimes when you are misled, see your own fingers pulsation and the pulse of the radial pulse, you cannot distinguish. So superficial temporal artery emerges from the base, transverse facial artery emerges from the anterior border. Now, parotid duct or Stenson's duct. Parotid duct can be a short note, 5 marks or whatever distribution. Your length is 5 centimeters. Formed within the gland by union of 2 vertical ducts. Your inside that emerges from the anterior border of the gland. Pores of the parotid duct. The duct passes forward on the masseter, parotid duct. The ramus of the mandible. This is the buccinator muscle. This is the masseter muscle. This is the parotid duct. Now lies between the upper and lower buccal nerve. At the anterior border of the masseter, the buccal pad of fat is there. Abruptly turns medially. Suddenly turns medially. Yeah. Turns medially, pierces the buccopharyngeal fascia. This is the buccopharyngeal fascia. And buccinator muscle. This is the buccinator muscle and the parotid papillae. Is lined by the mucous membrane. With the buccopharyngeal fascia, buccinator muscle passes between the buccinator and the mucous membrane of the cheek. Opens opposite the crown of the upper second molar tooth. You can be asked in the when the gross anatomy. The parotid gland is given to you. This is a common question. Where the crown of your upper second molar tooth. Blood supply of parotid gland, arterial supply derived from branches of external carotid. Veins drain into the tributaries of the external jugular vein. Nerve supply of the parotid gland, secretomotor supply from parasympathetic and sympathetic. Secretomotor supply and parasympathetic stimulation, watery secretion. Sympathetic stimulation, mucus-rich, sticky secretion. Parasympathetic nerve supply, preganglionic fibers, inferior salivatory nucleus of medulla. Preganglionic fibers into the inferior salivatory nucleus of the medulla. Fibers passes through the tympanic branch of your ninth cranial nerve, leave the tympanic plexus, relay into the otic ganglion, relay in the otic ganglion. Postganglionic fibers reach the gland via auriculotemporal nerve. Sympathetic nerve supply, preganglionic fibers from sympathetic trunk relay into the superior cervical ganglion. Postganglionic fibers reach the gland around the external carotid artery. Please, the parotid is very important. When a 10 marks question, viva can be there. And you see, when you go home, you see and read today only. And according to your definition and then your description, you please have separate, like the slideshow, you have a diagram and the note by your, you can see it in your Frey syndrome. Penetrating wound of parotid gland damages auriculotemporal nerve and great auricular nerves. Frey syndrome. Penetrating wound of parotid gland damages auriculotemporal and great auricular nerve. During healing, secretomotor fibers and the nerve joints, distal sympathetic fibers reach the sweat glands of the facial skin. During eating, perspiration occurs on the skin covering the parotid. Now, a patient comes with a sweat, he just complains that when I am eating, it is sweating. So, now, during stimulus intended for salivary secretion produces sweat secretion. So, every part, I'm just sitting with your permission. Now, every part of the gland, you have to, parotid ho jayega. Because head and neck, this is your first revision. Please mark my words. Please mark my words. Your class day is the first study and also the first revision. This is 1st of May, June, July, August. 4 months. Your lower limb, upper limb, you distribute like this. Lower limb, upper limb, 1 month. In between physiology, biochemistry, 1 month. Now, in the last lab, August, you have to study the whole body. So, then, now as it's head and neck is today we are starting 2-3 lectures. You please utilize, after you go to your dissection or demonstration or whatever you call it. I have no definition. But you spend, again I am repeating, you spend your time there. Like I lectured on tongue. I give the specimen there. And don't hesitate. In this juncture, please don't hesitate to ask for bones or your specimens. You are learning head and neck, now you want to see liver. You ask them. But what I am noting from the very first is that we are talking nonsense. I am telling you to classes up to 12:30 is the only thing, and also see, you don't have to clap. At least 10 tabs are there in one practical of 25 students. So 10 tabs are there, you please 5 people just. I'm telling you because of this, like yesterday, this boy from Panipat. Now, he is a latecomer. One madam is there from Midat, all like this, someone from Delhi. So they have lost 1 month or 2 months, whatever it is, 1.5 months. But that won't be considered as an excuse. Sir, मैं तो late आया था. I'm not warning you. I'm not making you, terrifying you. Or I'm not saying that you get scared. Don't get scared. Because once you get scared, then you go sinking. But you have to লেগে থাকতে হবে লেগে থাকতে হবে লেগে থাকার অর্থই বিজয় লাভ ও আমি দেখে নেব at the end you will be mum এই সামারে এসি চালিয়ে ক্লাস করছে না ও প্র্যাকটিক্যাল দেখে নেব আমি প্র্যাকটিক্যালসের কথা বলছি don't take it for granted কারণ why I'm telling you we are senior professors we come and sit okay आप ले लीजिए then we give. That doesn't mean that we will forcefully pass you. You have to say something.